What surprised me the most about my patients who are having more stem cells in circulation was really one patient in particular who started taking STEMREGEN, and she wasn't really sure if she was feeling any difference. But then we do these 1 to 10 check ins, and there are all kinds of different things. Like, one is for her, how stiff she was feeling when she stood out of bed in the morning. And all of a sudden, we were plateauing before, but all of a sudden, as she was taking STEMREGEN, she started feeling much less stiff as she woke up in the morning, and that has continued. Then, when we started probing into that, she started realizing her skin looked more youthful. She just felt better overall, but the change was gradual. So we had to really dive into those ratings that we do for her to realize it. I got the opportunity to interview Christian Drapeau, the founder, on my podcast, Wellness Your Way. I had never heard of STEMREGEN before that, but that was a great eye opener for me. And he convinced me to look into the research even more. Before I interviewed him for my podcast, I saw him at a couple of conferences. So I guess my interest was piqued already, but I started taking the product and started recommending it once I got the opportunity to really learn more about the research behind it. Personally started taking STEMREGEN because I will do anything to protect my longevity, my health, feel my best now and decades in the future. So while I personally didn't have any specific hindrance or issue that I was dealing with, I really like to layer in as many practices as I can on top of the foundations like exercise, nutrition, sleep, etc. And this was a great addition for me. For some of my patients, I recommend STEMREGEN if they're having trouble recovering just from their normal wear and tear, exercise, they're feeling the aches and pains of aging a little bit more than usual, or they're dealing with some kind of issue that will deplete their body's ability to recover even more. I'll recommend STEMREGEN to them. I think it's very difficult to have 100% confidence in any longevity metric, and that's what makes any of these emerging therapies really tough. So a little bit of it, I always acknowledge, is a bet, and we can do our best based on research. And the same thing applies even to nutrition, where nutrition research is constantly changing. We're making a bet on what we think is the best course of action, and we're continuing to do research as we go forward. As for stem cell regeneration and the STEMREGEN product in particular, I think the team behind STEMREGEN is really advancing the research at a quicker pace and a more careful pace than many of the other alternative products in the market. And so based on that, I really appreciate and put my trust in STEMREGEN. If my patients had more stem cells in circulation, they would for sure be able to recover better from the normal wear and tear of daily life, but also from the exercise. Many of my patients are athletes. They're really pushing their bodies hard and they need extra support recovering. And then many of my patients are also in their later years, in their 60s, 70s, 80s, and even 90s, and they need all the support that they can get to recover from daily activity. I would also see a reduction in inflammation, which is an issue for most people these days, and just more vitality, more energy to get through life. If someone's sitting on the fence between taking STEMREGEN or not, I say give it a shot. Try it for 30 days. See the differences that you can feel in your body. I'm confident that you will feel better, and look into the research as well. Understand the true power of stem cells for your health now and your future health, and go ahead and give it a shot. I'm Dr. Megan Lyons, Doctor of Clinical Nutrition in Dallas, Texas, and owner of the Lyons Share Wellness.